Hi, Ismo Linnosmaa. You are a professor of health and social economics and the vice leader of the Health Economics Research Group. Could you briefly introduce the research group and some of its key focus areas?
Okay, yes, thanks a lot, Piritta. I'm actually the Health Economics Research Group is a quite large research group. I think we have more than 20 health economics working in that group in the department, and there are sort of various projects and various sort of interests within that group that people are engaged in, and I'm going to focus on talking about two groups that I'm actually leading. The first one is Aging and Health and Long-Term Care Expenditures Group, and the second one is Survey of Health, Aging and Retirement in Europe-Finland consortium, and I'm leading both of those. So I thought I would say a few words about those groups because they are the active sort of research group that I'm leading, and we are doing a lot of work in these areas. So first about this Aging and Health and Long-Term Care Expenditures Group. At the moment, there are 12 researchers in this group. It's a multidisciplinary group. We have health economists there, we have statisticians, we have people from psychology there, and we have people from health management sciences. And actually, we are part of the bigger project called Economic and Social Sustainability Across Time and Space in an Aging Society. Abbreviation is SustAgeable, and we are being funded in this bigger project by Strategic Research Council of Finland. And this is related to, we are dealing with the topics of aging, population aging in Finland, and its economic and social consequences. That's the large sort of focus of this group. And the second group is also working on topics that are related to aging. It's the Survey of Health, Aging and Retirement in Europe, Finland. It's a consortium, and there are research groups from University of Eastern Finland. In this consortium, there are research groups from University of Tampere, University of Turku, and Population Research Institute. And this consortium will be responsible for coordinating shared data collection in Finland from Wave 11 onwards, and we are actually going towards the Wave 11 data collection already this spring. This consortium is being funded by the Academy of Finland, and perhaps I should say a few words about SHARE because not everyone might know this one. So SHARE is a European research infrastructure that has collected high-quality, multidisciplinary and longitudinal data on health, economic and social relationships of European citizens who are older than 50 years old since 2004. So there is lots of longitudinal data about European citizens in that data set. And currently there are 28 countries participating in the shared data collection, and Finland is one of those countries. So those are the two groups. Both of them are working on topics that are somehow related to aging of population. Yes.
Okay, wow.
Yeah.
Can you give some examples of the kind of research questions or challenges that these groups are addressing in their research?
Yes, of course. And the first one, in this first group, Aging and Health and Long-Term Care Expenditures, we are exploring, basically we have two research questions there. We are exploring the effects of population aging on health and long-term care expenditures. That's the sort of focus of our group there. But we are also looking for policy measures or interventions that are effective in containing the growth of health and long-term care expenditures without risking social sustainability. That's the constraint that we are keeping in our research there. And in the first, regarding the first question on the effects of population aging and health and long-term care expenditures, we have large population level data sets from Finland, and we have information about aging. We have variables that are related to population aging and variables that are related to health and long-term care expenditures, and we do sort of modeling we try to model the relationship between aging and long-term care expenditures. And we are also developing forecasting models that could be used to predict the effects of population aging on health and long-term care expenditures. And there's a lot of dealing with or managing the large data sets, and statistical modeling those are the sort of areas that we are working on those areas a lot in this first question. Regarding the second one, regarding these policy measures that are effective in containing growth of health and long-term care expenditures, we have been relying on the current evidence in the literature. So we are synthesizing the evidence that exists in the literature about policy measures that are effective in containing the growth of health and long-term care expenditures in there. So we have published some of this work already by now. Yes. And then the second research group, Survey of Health, Aging and Retirement in Europe-Finland Consortium. Actually, we have various research topics there that we are currently exploring. We are studying the effects of aging on health and well-being. There's one PhD student who is working on these topics. We are also studying the effects of informal care provision on health, mental health and retirement decisions. There is another PhD student who is working on this topic. We also explore work trajectories and the association with well-being of older workers. So in this research, we are focusing on those individuals who have already retired, and then they decide to work a little bit more and earn some money. And we look at what is the association between these working decisions and the well-being of these older workers. And the final question that comes very close to novel program is that we are also studying the prevalence and cost of cognitive health problems in Europe, and we use SHARE data in that study. SHARE has a lot of sort of cognitive health measures that can be used in this research, and we use those measures to compare prevalence and costs of cognitive health problems in Europe. We are comparing Finland and the other European countries in that study. So those were quite a lot of things are going on. So quite many things. Yes. Yeah.
Sounds like it.
Yeah.
And what are actually some of the achievements of these research groups that you are proud of?
Okay, thank you. Here I have to look a little back look at my history, and I think that I'm most proud of the development of the adaptation of the Ascot quality of life instrument to the Finnish setting. So Ascot is a quality of life instrument that can be used to assess the quality of life of adult social care workers and the informal carers. There are two separate instruments for service users and informal carers, and this instrument can also be applied in the effectiveness and cost effectiveness research on services and interventions provided for older social care service users and their informal carers. And actually I started this work already before I came to University of Eastern Finland. I was working at THL in 2015, and then we started this project, and it was done in collaboration with English and Austrian researchers. There were actually 3 research groups, one from Finland and from THL, one from England and one from Austria. But we are still working on some of the topics that are related to these instruments, and we are publishing sort of validation papers, and we are still estimating the so-called preference weights that are related to the development of these instruments. But anyone who is interested in this topic can find it from the Toimia database. Just Google Toimia and it's in Terveysportti, and you will find Ascot from there. It's there. There's more information about this instrument there. And then secondly, Secondly, I'm very excited about the current work that we are doing in these two research groups. And in particular, I sort of expect that we will produce reliable evidence on the effects of aging on health and long-term care expenditures. And these findings can be very useful for local and national authorities in Finland when they decide about how to allocate limited resources in health and social care. We will also produce evidence on interventions or measures that are effective in containing the growth of health and long-term care expenditures in aging societies, not just in Finland. We will produce evidence on reliable evidence on the effects of informal care on mental health and retirement decisions. And our plan, of course, we will develop novel approaches to measure and predict the prevalence and cost of cognitive health problems in Europe. So those are the things that I'm sort of expecting from these two groups. Yes.
Sounds like you're going to have great impact in the future.
Yeah.
And then what kind of you already mentioned quite a bit of this, but can you summarize what kind of collaborations you have both within the university and beyond it?
Okay, so in this first group on aging and health and long-term care expenditures, it's part of the bigger sort of project, and there are various research groups that are located in different parts in Finland, Helsinki, Turku. Some of them are in Tampere, and of course we do close collaboration with those groups. We also collaborate with national and local decision makers from ministries, from well-being counties. We are doing a sort of research with them together in this project, and we also have some researchers that come from Europe in this project. But the second group, the SHARE group, is very international. It's part of the sort of international consortium, this SHARE ERIC consortium, and we have a lot of international collaboration with all the groups that are participating in SHARE data collection in Europe. So there are 28 countries, all of them have a sort of representative in the SHARE consortium meetings. And we usually meet these groups twice a year. And just before the Christmas, we met all these people in Innsbruck, Austria, and now we plan to see them again in Athens, Greece, actually coming May this year. So there's a lot of international collaboration in this SHARE research group, yes.
Indeed.
Yeah.
Then the last and the most important question. Why should researchers choose your research groups for their postdoc? What makes these groups so amazing?
Okay, so I have to first say that they are relatively small. The first one is about the size of the first one is about 12 researchers at the moment, and the SHARE group, I think we have something less than 10 in that group. But I believe that the SHARE group will grow quite fast here at the University of Eastern Finland. So it's easy to join them at this point, at least. And then I think the most important thing for somebody who is considering this question, why should they join my research team, is that we have excellent data in both of our projects. So we have population-wide register data from Finland, and we have very high quality population survey data from European countries to study sort of various questions that are related to aging, health, well-being, and costs and cost effectiveness of services provided for older people, and also to those who are suffering from cognitive health problems. So I think that's the most important sort of thing for people.
Very important, yes. Indeed.
Yeah.
Thank you so much, Ismo.
Okay, thank you.